Hey guys, welcome back to my channel. Thank you so much for watching and showing love. I'm super excited today because we are talking about something that is very important, something that every nurse needs to know, and something that every nursing student will learn, and something that caught me off guard when I took basic med surg, and that is pharmacology. Pretty much with my classes, I didn't have pharmacology as a standalone class. It was incorporated into my basic med surg, and it's gonna continue to be incorporated into my future classes. And I know that some people do have pharmacology like just a pharmacology class, but mine isn't like that. So I'm gonna teach you guys how I learned pharmacology, tips and tricks that I use to memorize all 8 billion medications that we need to know, and side effects and everything else. And I hope that this is going to be helpful for you guys, so go ahead and just keep watching. Okay, so pretty much I'm going to start from the beginning. So like I said, I take pharmacology within my class. So we start by learning the disease process. I'm going to be using respiratory as my example for you guys, and I'm going to show you guys some of my notes. So these are just some examples of notes that I took for respiratory. This is like tuberculosis, more tuberculosis stuff. Just gonna fall on the floor. This is about bronchitis. Yeah, COPD, bronchitis, emphysema, COPD as a whole, and then asthma. So these are just examples of notes that I would take just so that I could reinforce what I was learning in class. After that, I would start to learn my meds. So also in class, we would go over this chart, and a lot of the times we would have to fill it out in class. So this is how it looks. It has the medication, why my patient is taking it, the nursing implications, how do I know it's working, and the adverse reactions. So this may be different from what you get at your school, but this is pretty much what they give us, and we fill it out in class, or it comes out pre-filled. Like this one I think is already pre-filled out, and this is everything that our professors want us to know. So like for example, in your school you may need to know more than this or less. It's just gonna depend. I know that what's on this chart, I'm responsible for knowing. My professors expect me to know what's on this chart. This is the stuff that I'm required to know for the test. So I would either fill it out or just start going over it. So there are like a couple of pages, you know, with all the meds. It is broken down into category like anticholinergic drugs, methylxanthines, inhaled corticosteroids. So there are quite a few, and this is just for respiratory. And this isn't even the antibiotics. This is like everything else except for the antibiotics. So just a quick review. Take my own notes and then start going over this med chart. I would go over this a couple times until I felt like I was pretty good on the information, on the content. Like for example, I would look at isoniazid, and I would say my patient is taking this because they have tuberculosis, so they're taking it to treat their TB or as a prophylactic treatment for TB. What are some nursing implications? So what are some important things for me to know as the nurse? Well, take B6 for deficiency. So it can cause a deficiency. So your patient may need to be on B6 vitamins. You do want to take this med on an empty stomach. That is super important because as a nurse, if you're administering this med and your patient just ate, you know that you want to wait because this needs to be taken on an empty stomach, or you just need to schedule it, you know, not around the meal times so that the patient isn't taking it late. So this is also like super important. Avoid alcohol while you're on the med. This goes into the patient education. You want to tell them not to be consuming alcohol, and avoid food containing tyramine and histamine. Examples of that are like aged cheeses, pickled foods, things like that. It has some type of, you know, interaction that we don't want to happen. And there is medication compliance for 6 to 12 months. I want them to be compliant for the whole course of the medication. How do I know it's working? Well, I know it's working when their blood culture comes back negative and when there's absence of TB bacilli, whatever. And then adverse reactions. These are things for you to look out for as a nurse. So it could cause hepatotoxicity, and it could cause peripheral neuropathy, which would present as numbness and tingliness because of their B6 deficiency. So that's an example of how I would talk myself through each med, like one at a time. Like, okay, this is why they're taking it. this is what I need to teach them, this is what I need to look out for. And I would really just say that over and over until I felt like I had a pretty good understanding of each med. And then from there, because there are so many meds to learn in general, I would use my whiteboard that I love. I got this from Target. It was like $10, I think, something like that. I would use this and I would write out all the meds. So like I said, take my own notes, go over the med chart, and then start to try to memorize the names of the meds, because you have to know the names of the meds. I learned the generic name, not the brand name, because on the NCLEX it is going to be only generic name. I'd rather know the generic names now, and then you kind of pick up on some of the brand names anyways while you're on clinical, while your professor speaks. So just learn the generic names to save yourself trouble for when you're studying for the NCLEX. So the NCLEX is generic names, not brand names. Okay, so I would take my whiteboard, and this is an example. I would write out like how the meds are grouped and then the actual name of the med. So I know that to treat TB, my patient can be on rifampin, isoniazid, pyrazinamide, or ethambutol. And I also have like a little mnemonic that I learned for this. I just like came up with it super quick, and it's RIPE. And so when I was thinking about it, I was saying, okay, how am I going to memorize which meds are to treat TB? And then I looked them over and I was like, oh, RIPE. Rifampin, isoniazid, pyrazinamide, and ethambutol, RIPE. So on the test, when I get my paper, I would write TB and then I'll write RIPE so that I already know which meds are used to treat TB. You can't do that with everything, but when you can, definitely do it. Look for those little tips and tricks that'll help you memorize it. Those little mnemonics and things like that. So then we have bronchodilators, and with the bronchodilators, they all end in OL. Well, they all end in like Terol. We have albuterol and we have levalbuterol that are short acting. That's super easy because you have albuterol and then the other one literally has the word albuterol in it. So I know that both of those are short acting. And then we have formoterol and salmeterol, which are long acting. So those two you just gotta have to memorize. Then we have some anticholinergic meds, and both of these end in PM. So that's kind of how I went about remembering them. Like if I saw ipratropium on the test, I would say, oh, that's an anticholinergic because it ends in PIUM. Methylxanthine, we have theophylline. Now this was the only one in this category that my professors wanted us to learn. And the way that I memorized this one, and I know I'm probably saying it wrong, I'm probably saying all the meds wrong, but I don't care. That's how I pronounce them. So theophylline, I say like that because it helps me remember that this drug has a very narrow therapeutic range. So when I say theophylline, I think of fine line. Like this drug has a fine line between therapeutic and toxic. So that's how I memorize that, because a big thing with this drug is that it has a narrow therapeutic range. Fine line, theophylline. We have mast cell stabilizers. We have leukotriene modifiers that both end in Lucast, so that's how I memorize those. And we have our inhaled corticosteroids. And this is basically my thought process, you know, that I'm showing you guys. You want to learn the material through your notes and through class. You want to memorize it using mnemonics and things that will help to make it stick. Whatever you need to do to make it stick, do that. With cardio meds, there's a lot of like OLOLs and ACE inhibitors and ARBs. There's a lot of things that are grouped together, which makes the cardiovascular meds a little bit easier to learn. But sometimes you're going to have groups that have nothing in common, like these two, cromolyn and nitocromil, and you kind of just have to memorize it, or you could like CROM, like you could look for little things that will help you memorize it. So that's important, because if you don't know the name of the drug, you're not gonna pass the test, you know what I mean? And then apply it. Apply it goes with reinforcing it, because that's when you're saying in your head, okay, why is my patient on this? What am I looking out for? That's when you kind of do the thought process in your head to kind of see how it'd be in real life. And also when you apply it in clinicals, when you go and you look at your patient's MAR and you see that they're on albuterol, okay, why are they on albuterol and what should I look out for and what do I need to teach them about this med? So clinicals is a great place to be applying these meds, and then reinforce it. So like I said, they're kind of interchangeable. You want to reinforce it in study groups, teaching each other, and you can also use this cool app and website called Picmonik. It is pretty cool. So it's basically a good way for the information to stick because it shows you pictures. It shows you pictures.
Will help you recall.
It shows you pictures to help you recall the information. So for example, they have one about albuterol that I'll show you guys.
Broccoli spaceship, which represents that albuterol is used to control bronchospasm. The troll uses his asthma inhaler to whip back his hair, signifying that this medication is sometimes used for acute asthma attacks. Side effects may include angina, shown by the angel with chest pain, overwhelmed by the outstanding...
Okay, so just from that little bit, you guys can already see that this website takes the med and it puts it into pictures so that, for example, when you're on the test and you have something like at the tip of your tongue, but you can't quite get it, you could just picture the Picmonik in your brain and it will kind of help you to remember it because you reinforced it that much more by using Picmonik. So it'll show you the animation and then it also has a review and it has a quiz so that you can see if you're retaining the information or not. I definitely recommend Picmonik. I'm gonna leave my link for my code down in the description box because you guys can get 20% off if you use my code. So definitely look into that if you need some help reinforcing the pharmacology material. They have like every med, every system, respiratory, cardiac, everything. It's really cool. And I also use Quizlet, which is free. Everyone knows Quizlet. I use Quizlet when I am trying to memorize it as well. And like I said in my other videos, I like Quizlet over flashcards because with Quizlet, I could have it on my phone. I could have it on my laptop. You know, I don't have to worry about, oh my God, I left my flashcards at home. No, I can't study. I always have my phone, so I know that I'll have the flashcards. And this is just an example of, I don't even know if you guys can see this, but like the respiratory one. So I would have isoniazid. And why is my patient taking this medication? What are my nursing implications? And then I would copy literally from the med chart that my professors gave me into here. So they're taking it because they had a positive PPD, they have tuberculosis or for prevention, take an empty stomach, avoid alcohol, everything that I already told you guys. How do I know it's working? What are my adverse reactions? Same things that's on the chart. Rifampin, why are they taking it? How do I know it's working? Adverse reaction. Treatment of TB, absence of TB, bacilli, and adverse is hepatotoxicity. So I'll do this for my meds so that I could constantly be studying and constantly be, you know, learning the information. And I vouch for Quizlet. I love it. And I do think that it's okay to look up quizzes that are already made, but it's so much better when you make your own because as you're typing it in, you are learning it, you're reading it, you know? So it does help more if you make your own Quizlet versus just looking up someone else's that has the same information. I really hope this was helpful. I really hope you guys look up some mnemonics when you're having trouble learning the meds. Like I said, cardiac has a whole ton that are grouped together, but try to make your own. Like how I made the RIPE when I thought about TB. I still have that memorized to this day, and I learned respiratory in like September, and I still have that memorized just because it's easy. Your brain is gonna remember things that are grouped together. They're gonna remember sayings and phrases like PEMDAS, please excuse my dear Aunt Sally. Everyone knows that, like no one will ever forget that just because it's something quick and easy and it's a phrase that you can remember versus just random information that is kind of hard for your brain to remember. And then just keep going over the information. Say it over and over and over until you get it. There are days when like maybe the night before the test, I'll clean out my whiteboard and just write down everything that I remember just to see how much knowledge I have. I'll write TB, isoniazid. What do I have to look out for again? What are my nursing implications? And I'll just write it out and I'll see, wow, this information really is in my head. And I know it is because I'm writing it from my own knowledge so that you know that you're not just memorizing it, but that you're learning it and that you're able to apply it and that you're able to go into clinical and like critically think when you look at a patient's MAR and things like that. So that is how I tackle pharmacology. It is a big feat, and it's not easy, especially if you don't have like a photographic memory. I do not have a photographic memory. I think my memory is trash, but I just work that much harder and just keep going over it just to make sure that I'm understanding, memorizing, learning this information as best as I can. So I really hope this video was helpful. I really hope you guys, if you have questions, that you'll leave them in the comments. And if you have comments, you'll leave them. And if you have some tips better than mine, different than mine, whatever, leave them down below. I could still use tips. I'm still going to be introduced to new meds in my upcoming semesters. And other people will probably find it helpful as well. But thank you guys so much for watching and tuning in.